There's a lot of new interest generated in the treatment of autism. As we all know, autism is more diagnosed nowadays and it's more prevalent. Even in India, the incidence of autism is increasing. Now, as we all know, autism is reclassified as ASD, Autistic Spectrum Disorder, indicating that it is multifactorial. Not one single condition is held responsible for the clinical condition of autism, but it can be multiple factors or a cohort of factors in the same child. One of the molecules which we looked into is a beta glucan, specifically produced by Arabasidium pullulans, and a product called Nichi GLOW.
The pristine waters of Niagara River is one of the important and indispensable ingredients for culturing the Aureobasidium pullulans, enabling the production of Nichi glucans. The GMP certified facility in Kochi Prefecture, Japan, where Nichi glucans are manufactured.
There are plenty of beta glucans available from the fungal sources, but this is the only kind of beta glucan that is produced as a exopolysaccharide. Hence, there is no need of much chemically oriented purification process. Hence, this is a naturally occurring food supplement, and it does not classically fall under the classification of a medicine, because traditionally the beta glucan from this yeast has been used as a food supplement by Japanese population.
We performed a study in which there were 18 participants with autism spectrum disorders in total. 6 subjects underwent conventional treatment comprising remedial behavioral therapies and L-carnosine. 12 subjects underwent supplementation with the Nichi GLOW along with conventional therapies. The study results showed CARS score improvement, indicating improved behavioral pattern in all of the children of the Nichi GLOW arm compared with the control. Plasma levels of neurotransmitter alpha-synuclein were also significantly higher in Nichi GLOW arm than in the control group.
In autism, we know that poor synaptic communication and synaptic activity is the problem for poor socialization skills and language skills and behavioral issues.
My name is Mrs. Sri Devi. I am the mother of Master Rohit Vishwakumar. My son was lagging behind in speech, though he was 3 years old. So that time we found an abnormality in him, and we found out he has an autism problem.
I am seeing Rohit Gugan for the past 3 years. Before taking Nichi Glucan, Rohit is active in daily life, but his communication skill is very bad. His language proficiency is not age appropriate. He tried to express his ideas using very simple words only. But after taking Nichi Glucan, his sentence formations are very good and his communication skills has improved very better.
Rohit Gugan is a little boy who I have been following for last 3 years. When I first met him, he had a lot of restrictions, very poor social skills, very poor language skills, and literally he had only very few words in monosyllable and had lot of behavioral issues and sleep problems.
A special thanks to Dr. Mr. Raghavan sir for giving an upliftment in my son's life. Nichi GLOW has played a vital role in my son's autism symptoms to get reduced. He has improved a lot from initial stage, like he is keen about the surroundings around him, and he is listening to the words which we speak. Initially he was struggling with sleep, like he used to wake up in the midnight, but right now he has a continuous sleep, which is good in his improvement.
மேத்தமெட்டிக் கால்குலேஷன்ஸ் அவங்க நிறைய இம்ப்ரூவ்மெண்ட் நாங்கள் பார்த்தோம். அடிஷன், சப்ராக்ஷன், மல்டிப்ளிகேஷன் ஆல்சோ. மல்டிப்ளிகேஷனில் வந்து என்ன சொல்கிறது, ரொம்ப ஃபாஸ்ட்டாக வந்து அவர் ஆன்சர் டக்குன்னு எங்களுக்கு சொல்லிடுவார். இந்த இம்ப்ரூவ்மெண்ட் வந்து இப்போ ரீசெண்டாக வந்தது நாங்கள் நோட்டீஸ் பண்ணோம்.
But after taking Nichi GLOW, his sentence formations are very good and his communication skills has improved very better.
Classically tried various regimes of medications including risperidone and the methylphenidate. He had some amount of response, but when we added the Nichi GLOW, there was a significant improvement in his sleep cycle, and as you heard from the parents that his behavior changed a lot, and more to my surprise, I was more impressed to see his intellectual skills, his cognitive skills, particularly language and numerical skills have increased in big leaps.
These encouraging outcome of the pilot clinical study have been published in BMJ Neurology Open Journal. The gut microbiome of these children have improved significantly after consumption of Nichi GLOW, and the data are under peer review.
வணக்கம், என் பேர் கோபாலகிருஷ்ணன், சொந்த ஊர் போடிநாயக்கனூர் சார். என்னுடைய மகன் வழி பேத்தி சர்விகாவோட வைத்தியத்துக்காண்டி வந்தாங்க.
சார்விகாங்கிற குழந்தை எங்களுக்கு 2 வருஷமாக தெரியும். ஃபஸ்ட்டு வந்து அந்த குழந்தை பார்த்தீங்கன்னா எப்படின்னா ஒரு ஸ்கில் டெவலப்மெண்ட்டு கூட இருக்காது. அந்த குழந்தை அடமன்சி பிஹேவியர் அதிகமாக இருந்தது. அப்புறம் கம்யூனிகேஷன் ரிசப்டிவ் லாங்குவேஜ் எல்லாம் ரொம்ப கம்மியாக இருந்தது. ஒரு அப்சர்வேஷன் வந்து ரொம்ப புவராக இருந்தது.
Little girl Sarvika that we saw today was in a very kind of spectrum between moderate to severe ASD. She was very much silent and we were not able to penetrate into her world. It was very difficult to get to communicate with her, and she was to an extent very resistant with the standard treatments, and we were reaching nowhere with her clinical signs and symptoms.
நிச்சி குளுக்கான் சப்ளிமெண்ட்டை லாஸ்ட் 1 மந்த்தாக அந்த குழந்தை கொடுத்து பார்த்தோம். அப்படி கொடுக்கும்போது அந்த குழந்தையுடைய ரிசப்டிவ் லாங்குவேஜ் டெவலப்மெண்ட் ஆரம்பிச்சு, அப்சர்வேஷன் கூடுச்சு. அப்சர்வேஷன் கூடுறனால பிஹேவியர் ப்ராப்ளம் குறைய ஆரம்பிச்சிச்சு. பிஹேவியர் ப்ராப்ளம் குறைய அப்சர்வேஷன் கூடி கம்யூனிகேஷன் ஸ்கில்லும் நல்லபடியாக டெவலப்மெண்ட் ஆக ஆரம்பிச்சிச்சு.
முதல்ல என் பிள்ளைக்கு கான்சன்ட்ரேஷன் இருக்காது, ஆக்டிவிட்டீஸ் வந்து கம்மியாக இருக்கும். இப்போ வந்து மெமரி பவர் ஓரளவுக்கு பெட்டராக இருக்குங்க. டாக்டருடைய அட்வைஸ் படி நிச்சி துக்கான் சப்ளிமெண்ட்டு சாப்பிட்டதுக்கப்புறம் என்னுடைய பேத்தி சர்விகா அவனுடைய இம்ப்ரூவ்மெண்ட் கொஞ்சம் நல்லா இருக்குங்க.
Her activity has shown a very good improvement and she was looking at what others are talking. She was responding to a simple commands and her task specific activity has improved better.
And to our surprise, she started opening up in a very nice way. She started communicating very nicely, and now she is very expressive to a point, meaning it's not fully 100%, but she is much better than what she was before, and also her appetite increased. Her sleep cycle can be even more better, but she is much better than what she was, and I can see parents being very satisfied with this treatment of this food supplement. And I need to tell you again that the occupational therapists were blinded. They did not know which children were in supplement and which children were not. The intervention group with the Nichi GLOW New GLOW improved in their sleep, and hence there is improvement in their behavior and improvement in their concentration, and there is improvement in their cognitive skills. We are planning to do a MRI study and to see if there is any demonstrable improvement in certain areas of these children, comparing their pre and post MRI. So this study we are taking up next, and we wanted to see for clear evidence of this beneficial effects, and in the future we plan to do further studies with a large number of children, and to see which type of children are going to benefit from this food supplement. Thank you.